Hi, Dr. LeBron. Thanks for coming here. And I just wanted to learn a little bit more about you and your clinic and just have this conversation together. So tell me a little bit about your background and some of the things that you're doing now.
Okay, well, first of all, thank you so much for having me here. I'm Dr. LeBron. Currently, I'm working here at Harmony Medical Concierge here in Maitland, Florida. We have a clinic that's basically tailored to every individual in a concierge type of way. The reason why I decided to offer this type of service is because I've seen that in the healthcare system lately, there's been a lot of need for just basically seeing patients, in a fast way, not being able to really listen to them, which is 80% of what you can get from their health in order for you to help them. We wanted to make sure that we offer this community the best type of service, and I just basically, I've been working in emergency medicine for many years, and there, unfortunately, I'm not able to take care of patients in an individualized way. And I thought that opening Harmony Medical Concierge, I'm able to do that, where I'm able to give a service in an individual way and just make sure that patients are really treated how they should be.
Mm-hmm.
So,
I think that's something that we have in common. I think that's part of why we decided to start different clinics, just to be able to spend a little bit more time with people in a different way than what we were used to in the past.
exactly.
So how long have you started Harmony Medical?
So we've been pretty much open since January of this year. We basically started first doing a little bit of home visits. From there, then we decided to open an office so that patients can go directly to us if they don't feel comfortable for us going to their homes. And so basically, we've picked up in May a lot. That's when the office per se, was established in Maitland, and we've been doing good so far there.
That's great. So you make home visits or people can come to the office. It sounds pretty flexible.
Yes, that's
Great. So tell me a little bit about some of the things that you offer with Harmony Medical.
Sure. So right now, basically, we're offering IV vitamin therapy. We're also offering medical weight loss. We're offering wellness exams just to kind of see, all the medical conditions that we can possibly gather information from when we see you on the first visit. We also do hormone replacement therapy as well. And one of the things that we're very excited with is to work with mental health, and we've decided to then introduce ketamine therapy, which we're very excited to have you as part of the team. So thank you so much.
Yeah, it's been pretty fascinating being able to incorporate that into my practice as well. I'm sure you felt the same way, that I think when it comes to mental health that we have always had some limited options to help people outside of therapy and lifestyle interventions. When it came to medications, there's always some limited benefit. Some people do really well on it, some people don't. And for the people who don't do well with the medications, it seems like ketamine could be an option for them. What's been your experience so far with working with ketamine and treating mental health issues?
So I think that ketamine has been something that's been like a big breakthrough. I've seen that patients do very well in it. As medications, like you said, have been prescribed for many years for things such as depression, anxiety, PTSD, sometimes can take very long time with medications to make effect. It could have many side effects, and one of the things that I loved about ketamine therapy is that when I'm treating patients, I actually see things, within like hours to even days.
Mm-hmm.
So I think, there's a lot of stigma out there going on right now with just getting treatment for mental health, and I think that it shouldn't be that way. I think it's very important to have, mind, soul, body completely under control. And I think that this is a very innovative way of just kind of like treating those medical conditions, when there's just no other resort. So
Mm-hmm. I think that's a good point, treating mind, soul, body. And I think oftentimes we're so used to separating everything from one another, and we forget how often intertwined and each of those aspects can affect the other.
Exactly.
And I think that's what's pretty interesting about the ketamine therapy. From what I've learned, there is this, or it can have this spiritual component for some people. I know you recently attended a conference in Michigan about it. Can you talk a little bit about some of the different experiences people have had while going through the treatment?
Well, yeah, I mean, basically what the treatment does the most for a lot of the patients, from my experience, with the trainings that we had, was that it kind of, it causes this dissociation where they kind of let go of their ego and they allow you to introduce to them, you know, like guidance, or like if you're giving them some type of like psychotherapy, it allows them to like absorb it more, because it takes away that part of them that's just like not allowing them to take in, the benefits, of like the psychotherapy, for instance. What I saw was that basically, the patients feel more even comfortable. It kind of loosens the patient up while you're there. They're very more expressive towards their feelings, and they come back for more. Like they really feel like it's making a difference in their lives. And then I've seen also from when we're training there and from experience, that some of them were being weaned off these medications, that were making them like feel bad. So I really like, starting with traditional medicine, now going a little bit more into functional medicine that we're also caring for patients right now. I really like the fact that this is something that can reduce more like medications in a patient, because at the end of the day you want to try to make them be as natural as possible, and towards a treatment option.
Yeah, I think that's a good point you brought up with integrating therapy into some ketamine treatments as well, because the way it works with that dissociation, that separation from ego and self, I think is a helpful component that allows people to be a lot more receptive to therapy and
Exactly.
able to make those changes. So that's definitely a popular area of research that I'm continuing to learn about too. We think about treating patients spiritually, looking at their social aspects, their lifestyle aspects, as well as their biological symptoms, and I think that it's helpful to integrate various modalities into treatment, because I think there's just not a one size fits all approach for most people. It might be a combination of different things, and everyone's timeline is different. So I found, especially with ketamine, that it helps people make those lifestyle changes a little bit easier. They're more able to integrate maybe decreasing alcohol intake, or trying to prioritize their sleep, maybe healthy social supports. And I think that's what I think the long run benefit is with integrating therapy with ketamine, is because it helps you make those long-lasting effects rather than just relying on one modality to improve your well-being.
Exactly, and me as an emergency medicine physician, obviously, we make sure that the patient feels very safe when they're receiving these treatments. They're basically being monitored at all times. This is something that we secure, the patient, and we have them in a cardiac monitor. We make an environment that they feel, cozy and safe, and it's something that patients should know that they shouldn't be concerned for that, and that's part of why we decided to also go and just continue these trainings, to make sure that we're always offering it in the best possible way for our community here.
Mm-hmm. So that's something that you guys prioritize, is definitely safety.
Yes.
Of the patient. You have everything available in case anything happens, which is rare, but it's always comforting to know that patient safety is the top priority.
Yes, correctly. And we have all options. We have currently IV right now, and then we're also doing intranasal. So, if somebody's scared of needles, then they have that option as well. And yeah, they're both very effective.
Yeah, I was going to ask. So say if you are a patient who has maybe tried different medications to help with depression, for example, or anxiety, and didn't have much benefit, and they're looking for something new. What would be the best way to know if ketamine might be a good option for them, and what steps to move forward from there?
Yeah, well, the most important thing is first, obviously, to just make sure that ketamine is right for them. You know, we make sure that we do this questionnaire where we ask them several questions based on their history, based on their health. And then once we qualify for ketamine, we decide if it's going to be like an intranasal route. It's more for like treatment-resistant depression or major depressive disorder with suicidal ideations, or if not IV therapy, if it's for like PTSD, anxiety, OCD, as well as major depressive disorder and treatment-resistant depression. And even if they have underlying conditions that cause, like chronic pain or fibromyalgia, these other things that can cause mental health disorders because they feel bad because of the pain they're experiencing, and ketamine is also used for that as well.
So do they necessarily need to go through another physician or provider to get a referral from you, or they can contact you directly?
So they can contact us directly, and we'll make sure that we do a full, complete checkup. We do blood work and everything. We do a physical exam, and then if need be, then we would refer to you as our doctor in psychiatry in order for them to make sure that this treatment is right for them based on their past medical history and medications that they've been on before, and their diagnosis for mental disorders and stuff.
So with an evaluation with me prior to ketamine treatment, patients would just go through their history, things that they've tried, what's helped, what hasn't helped, and learn a little bit about their past, family history, anything like that. And typically, if all goes well, then they're referred back to you, and it doesn't sound like there's too much of a wait time in order to get an appointment with you.
No, not at all. It's very quick. We have a free consultation, approximately like 30 minutes, just to see the necessity of the patient, again, the qualification of the patient, and then from there, then if they're cleared for ketamine, then that's when we refer to you. And then after, your guidance with the psychiatric evaluation, they come back to us right away. So it's a very quick process. It can take less than 24 hours.
Great. Do we know much about, so after the initial treatments with you, what do the next several months look like for a patient, or even years to come? What would something typical that they would expect from the treatment?
So the treatment can typically last around 4 to 6 weeks. So we recommend boosters. Some studies have said that even up to 3 to 6 months, patients can experience the benefits of ketamine, and they really don't need to get those boosters. But if they start feeling the need to use the treatment again, then normally, every 4 to 6 weeks they can come in and get one therapy. But normally the initial treatment for ketamine therapy is a treatment of 6 series. The patient comes in, they're with us maybe approximately 40 minutes, maybe to 2 hours, and then they'll come in for at least 2 to 3 weeks for those 6 treatments, and then from there we'll do the subsequent treatments, like I said, the boosters if necessary.
Is there anything that they need to watch out for or avoid during the time for treatments?
So basically the recommendations are always to avoid anything that's like a stimulant, like caffeine before treatments. If they have any medication for for ADHD or ADD, some of these stimulants can affect the treatment a little bit, in terms of efficacy. So we recommend holding it the same day. It's also highly recommended to avoid alcohol. Within the day before and even up to 72 hours after treatment, to allow this neuroplasticity that ketamine offers in terms of what the ketamine does and mechanism of action. Then those are the type of things that they normally avoid, and we also try to have them avoid things that are the cause of what's causing their symptoms for them to get the help, or if possible, the stressors that they're having. So we always recommend them to make sure that when they do these appointments to just kind of have like the day off and, maybe possibly even be off from work or even be on a period of vacation so that they could really get the benefits of this treatment.
I think that's a good point with the neuroplasticity and ketamine, because that's one of the driving mechanisms, one of the many mechanisms with ketamine is that allows that neuroplasticity. So that's an opportunity for an adoption of healthier habits, lifestyle changes, so that it changes the brain and makes it easier to continue to make those changes and have longer improvements.
Exactly.